name is Melissa Rao, and I'll be teaching you the technique of CPR today. A little bit about myself. I have been in the medical field for over a decade, and I started taking CPR courses about 5 years ago when I became a radiologic technologist. I found CPR to be a very vital skill and believe everyone should get trained in the basics of CPR. It is a simple thing to learn, and knowing it could save someone's life someday. Hopefully no one will have to use it, but if you do need to, it could be the difference between someone's living and someone not living. CPR basics can help someone immediately, but even being able to do it until the medical help arrives can have a drastic impact on how someone recovers. I've taken many CPR courses over my career and found a few presentations to be more helpful than others. I have taken the best methods of what I found to be most helpful styles of teaching to hopefully educate you and to feel more comfortable in performing an emergency CPR scenario. Okay, let me ask you to raise your hand if you are familiar with CPR. Nobody? Okay. Well, today we'll get you a little more familiar before you go take your CPR certification course. Okay, now let's get to know each other a little bit better. I would like us to go around the room and have everybody tell us your name, what your current occupation is, and why you would want to learn about CPR. Shonda, let's start off with you. Yeah, sure.
Hi, I'm LaShonda Matthews. I am a pharmacy tech here at the Texas Cardiovascular Hospital. And I need to learn CPR just in case something happens with someone in my family. I would like to know how to do that.
Alright, you miss?
You was just a student.
My name is Trinity. My occupation is school, and I learned CPR because I have friends that have asthma, so if they fall down,
That's a very good reason. Alrighty.
My name is Rajiv. I am a regional sales manager for a health insurance company. CPR is just a good tool to have just overall, especially with the day and age we're in, full of allergies, and people always in the middle not paying attention to what they're doing.
Hi, my name's Camilla Rao. I am a caretaker. My dad has heart problems, and I want to be able to help him if something should arise. So that's why I want to learn all about this.
Those are all very good reasons, and I'm glad to have you guys here today. And we're going to go through a little PowerPoint slide presentation, and we'll practice on the dummies of CPR. Alright, fundamentals of CPR. To introduce you to CPR and a little bit of the history, CPR dates back to the mid-1740s when actual mouth-to-mouth resuscitation was used for drowning victims. In the early 1890s, there was a Dr. Massey that performed the first documented chest compressions on a patient. In the early 1900s, there was a Dr. Krill that was the first one to successfully use chest compressions for human resuscitation. In 1960, the CPR was developed by the American Heart Association, and the program started to start teaching individuals how to perform CPR. In the 1980s, CPR was developed for pediatric and neonatal patients specifically. And in the late 1980s, pediatric courses were started to be teaching to everyone. And in the 1990s, there was a PAD programs that became available for fibrillation. And in 2005, the AHA developed a family and friends CPR anytime kit that would be very useful for anybody to utilize while performing CPR. Okay, what is CPR and who needs it? CPR is a cardiopulmonary resuscitation. Is an emergency procedure performed in an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in a person who is in cardiac arrest. It is indicated in those who are unresponsive with no breathing or abnormal breathing, for example, angina respirations. Quick question. Who, when you come upon somebody who is unresponsive, what would you do?
I would assume to check their pulse first and see if they're choking. I would assume.
Call 911.
That's good. Okay, any other suggestions? There you go. Normally, if you come upon somebody who's unresponsive, like you said, see if their response, check their pulse, and if there's nothing going on, then you can start performing CPR chest compressions and then give their 2 breaths. If somebody else is around, you can have them call 911, call out for help, and go from there until medical assistance comes. Okay. There's different CPR technique for infants. First, you want to check if the infant child is responsive. If they're not responsive, then you can call out for help. You always want to check to see if there's anything in their airway. And if there is, if you can scoop it out with your finger, go ahead. If not, then start giving 2 breaths. And then if there's still no pulse on the infant, then you can begin cycles of compressions and ventilations for a 30-2 ratio. After 5 cycles, if there's still no response from an infant, then you need to call for medical assistance and start again until medical assistance arrives. And pediatric or infants are very, very fragile, so just be really careful when you start doing your chest compressions. And for infant 2 respirator CPR, one person is going to be at the side of the victim, and they'll perform 15 chest compressions. And you're going to take with your 2 thumbs encircling your hands. You're going to count aloud. The second respirator is going to maintain the open airway, and they're going to provide breaths that make the chest rise. And you're going to switch duties in between the respirators every 5 cycles or 2 minutes, and you're going to take less than 5 seconds to switch out, because you don't want it to be too much of a delay in between giving chest compressions and the breaths. Chest compression for the infants, you want to draw an imaginary line between the nipples and place 2 fingers on the breastbone just below that line. That will enable you to compress on the lower half of the breastbone, and it'll allow you to give chest compressions and press on the infant breastbone down about 1/3 to 1/2 the depth of the chest. That'll ensure that you won't fracture their sternum and cause other complications. After each compression, you'll completely release the pressure of the breastbone and allow the chest to re-expand completely. And the compression ventilation ratio for the 2 respirator is a 15-2. Okay. Rajiv, is there a difference in child CPR than in infant CPR?
Yeah, the difference in the amount of compressions and the ratio is 30-2.
Okay, good answer. Okay, for the chest compressions in a pediatric individual, you're going to press down about 1/3 to 1/2 for the depth of the chest with each compression. You're going to make sure that the victim's airway is open and assess their breathing. If the patient is unresponsive and not breathing, then you're going to give 2 breaths and check their pulse. You're going to then perform cycles of compressions and ventilations 30-2. at a ratio of 100, at a rate of 100 compressions per minute. With a 2-person rescuer for CPR, the first person is gonna stand at the side of the victim. They're gonna perform 15 chest compressions. They're gonna count aloud, so the second rescuer will know what the pace is. The second rescuer is going to be at the head of the victim. They're going to give 2 breaths and ensure that the victim's chest rises. Then the 2 rescuers are going to switch duties every 5 cycles or 2 minutes, taking less than 5 seconds to switch out. Because again, you don't want to delay and cause any further complications with the patient. We're going to continue that CPR until medical assistance arrives. Okay, adult CPR. Rajiv, what is the difference between adult CPR and pediatric infant CPRs and the chest compressions?
I believe it is the distance that you actually can press down. The adult, you can go down further, which is 1 1/2 inch to 2 inches with the compressions.
Correct. Good job. Okay. For adult CPR, for 1 rescuer, you're gonna come upon the patient. You're gonna look, listen, and feel for the breaths. You're gonna check the victim's airway, make sure that there's nothing in there. If you can't see anything, then you're gonna do a head tilt chin lift maneuver. You're gonna check for the pulse, and then you're gonna begin ventilation ratio of 30 compressions to 2 breaths when giving a CPR on an adult patient. For your chest compressions, you're going to press down about 1.5 to 2 inches for each compression. This is a little bit different than the pediatric and infant because you're having to go a little bit further on an adult because of their size. And again, you don't want to go too hard on any compressions because you could fracture the sternum and cause other complications. You're going to continue this until the patient becomes responsive or until you get a medical assistance arrives. Okay. For adult 2-person rescuer, the first rescuer is going to be at the side of the victim. They're going to be the one performing 30 chest compressions, and they're going to count aloud so the second rescuer can be aware of what their cycle is. And then the second rescuer is going to be at the head of the victim, giving 2 breaths to ensure that the victim's chest rises. And then the 2 rescuers are going to switch duties every 5 cycles or 2 minutes, and you're going to take less than 5 seconds to do the switch so that you can ensure the CPR will continue on. Okay. For those of you that are wanting to continue to get your CPR certification and possibly go on to teaching CPR, there's several things that you need to do. You can go to the American Heart Association and sign up for one of their CPR classes, or go to BLS Provider and sign up for one of their classes to get certified. They'll basically go through the motions of CPR, they'll watch you do it, do a little test at the end, and they'll sign off and you'll get your certification. You do have to renew your CPR certification every 2 years to keep it accurate and up to date. And there's also other classes that you can take and other ways to get your certification. Okay, now let's have a little role play action with the CPR dummies. You're gonna kind of pretend like you've come upon an unresponsive patient and kind of check their response, check their pulse, and then do the chest compressions and the breaths. And I'll kind of help out and walk around the room and make sure that you're doing it correctly. So who wants to go first? Shonda?
Yeah.
Okay. Yeah, let's do it at your table.
Okay. Oh no, are they breathing? Is it one of us check the pulse first?
Just be like, hey, are you okay?
Are you okay? No response.
Just check their airway. If everything's good, then you'll start doing 30 chest compressions. down deep, and you'll hear that clicking sound on the dummies. Count in your head, count aloud.
Do they do 30 on TV on all the movies and everything?
They probably don't on the
Seems
TVs.
like they don't.
They don't do it as accurately as they should. Alright, that's 30, so you'll give 2 breaths. And just head, tilt, chin, lift. There we go. Alright, and then you'll do 30 more.
30 more?
And
Yeah, I always wanted to do.
Alright, and then that's 30. Give 2 more breaths. And then we'll call out for help.
Help, could someone call 911, please?
And then basically that you'll do that for 5 cycles until medical assistance arrives, and they'll hopefully start breathing and recover through. If not, they'll be taken off to the hospital, and further medical assistance will be.
I have a question.
Okay.
Like on an older person, someone who's in their late 80s, are you still going just as deeply, or would you be a little bit more general?
You know,
An
adult.
elderly?
If you're adult, you're still going to go 1.5 inches deep.
No matter the age.
No matter, as
For
long
an
as they're
adult.
adult. You don't want to go too hard, because you do risk the fracturing their sternum, and you don't want to do that. But just you'll feel it once you kind of get an emotion, and when you practice on the dummy, you'll kind of get a better idea. But yeah, it's the same for adult. All right, y'all want to give it a try?
Want to go ahead?
Okay. Alright, I check for pulse first.
You go up there, be like, "Hey, are you okay?" Then you'll check for the pulse around the carotid.
Okay, so no pulse.
Okay, so then you'll check the airway. You'll head, shoulder, lift. Okay. There's nothing in the airway. Then you'll start compressions, 30 compressions. Right there. That's good. Okay, that's 30. And then you'll give 2 breaths. So head, chin, shoulder. And breathe 2 breaths.
Okay, 2 breaths.
And then you'll do another round of compressions. And then do another 2 breaths. Right. And then from there you'll call out for help. Help, somebody call 911, and they'll go get medical assistance. Yes, and you'll continue that for 5 cycles. And then medical assistance, when they arrive, they'll come take the patient to the hospital or continue CPR and go from there. Rajiv, did you want to practice or anything?
Me too. I'm good.
All
She
right.
did a very good job of providing an example.
All right. So y'all are familiar a little bit with CPR and working with the dummies. All right, so in conclusion, today we have covered some of the history of CPR, what CPR is, who needs CPR, the techniques of infant CPR, both with 1 rescuer and 2 rescuers, the technique of pediatric CPR with 1 rescuer and 2 rescuer, and the technique of adult CPR with both 1 rescuer and 2 rescuer, and how to get your CPR certification, and then we just demonstrated performing CPR on the CPR dummies during our role play activity. Does anybody have any questions about the information covered in today's presentation?
No, I'm good.
Everybody's good? All right. Well, I just want to say thank you for coming, and there's some refreshments in the back of the room. Y'all feel free to grab some, and there's also an evaluation form in the back of the room. If y'all want to fill it out, just see get your suggestions on how the presentation went and what y'all liked about it. Anyways, y'all have a great day and good luck with your CPR classes.
Thank
you.
Bye.